The deltoid attaches to the lateral clavicle, the acromion process, and the spine of the scapula. From this attachment, it runs distally to the deltoid tuberosity about 1/3 the way down the humerus. It has anterior fibers, middle fibers, and posterior fibers. To engage the entire deltoid, we resist abduction of the arm at the shoulder joint by resisting proximal to the elbow, and the entire muscle contracts and we can palpate it. To best palpate the anterior deltoid, we resist horizontal flexion of the arm at the shoulder joint. And to best palpate the posterior deltoid, we move to the other side of the client and resist the client from horizontally extending the arm at the shoulder joint, and we see the posterior deltoid engage, and we can palpate it. The biceps brachii is superficial in the anterior arm. When it's relaxed, it can be pinched away from the other musculature. The lateral border between the biceps brachii and brachialis is especially easy to locate. To engage the biceps brachii, have the client try to flex the fully supinated forearm at the elbow joint against our resistance and then strum perpendicularly across it. Make sure that the resistance is added to the distal forearm. Do not cross the wrist joint to hold the client's hand, or other muscles will be engaged that will make discerning the biceps brachii more difficult. We then follow the biceps brachii to its distal attachment on the radial tuberosity. We then go back and palpate the biceps brachii proximally. Its proximal attachments run deep to the pec major and deltoid. The biceps brachii can be traced approximately like this. Here is the supraglenoid attachment of the long head. There is the coracoid process attachment of the short head. To access these proximal attachments, we need to press in deep to the pec major and anterior deltoid, and we ask the client to flex the fully supinated forearm. By pressing in deep, we can access the coracoid process attachment. However, the supraglenoid tubercle attachment is not possible to palpate. The brachialis is deep to the biceps brachii anteriorly, but is superficial laterally. It attaches from the distal 1/2 of the anterior humerus, starting right next to the deltoid tuberosity, and then it runs distally to cross the elbow joint, and it attaches onto the coronoid process of the ulna and the ulnar tuberosity. Because the brachialis is deep to the biceps brachii anteriorly, it is best to first locate it laterally. To engage it, whereas the forearm was supinated for the biceps brachii, now we have it fully pronated. When the client flexes the forearm at the elbow joint, we can strum perpendicularly across the brachialis. If resistance is added, it should be gentle, or the inhibition of the biceps brachii will be overridden, and it will be more difficult to palpate the brachialis. When the biceps brachii is reciprocally inhibited, we can even palpate the brachialis right through the belly of biceps brachii. When the client flexes the forearm at the elbow joint, all muscles that cross the elbow joint will be engaged. If the client's forearm is fully supinated, the biceps brachii is the elbow joint flexor that primarily contracts. If the client's forearm is fully pronated, it's the brachialis muscle that is primarily engaged to contract. If the client's forearm is in a position that is halfway between full pronation and full supination, it will be the brachioradialis that will be primarily engaged to contract. The coracobrachialis attaches from the coracoid process of the scapula to the middle 1/3 of the medial shaft of the humerus. To palpate this muscle, we first find the coracoid process. We do this by locating the distal clavicle and drop off its concavity onto the coracoid process of the scapula. Here is the line of the coracobrachialis. To engage it, we place the client's arm into 90 degrees of abduction, and then we ask the client to try to horizontally flex the arm at the shoulder joint against our resistance. We curl our palpating fingers in from the underside, and as the client contracts the coracobrachialis, we strum across it, up and down. We must be careful with our palpation in the medial arm because of the presence of the brachial plexus of nerves and the brachial artery. To palpate the attachment on the coracoid process, which is deep to the pec major, we reach in deep to the pec major slowly with gentle but firm pressure, feeling for the engagement of the muscle as the client tries to horizontally flex the arm at the shoulder joint against our resistance. The brachioradialis runs from the lateral supracondylar ridge of the humerus to the styloid process of the radius. It crosses the elbow joint. To engage it and make it pop, ask the client to flex the forearm at the elbow joint against resistance. Be sure to add the resistance to the distal forearm and not to the client's hand. When the client engages the muscle, we begin palpating it proximally, and we strum perpendicularly across it, and we then follow it in baby steps toward its distal attachment as the client alternately contracts and relaxes the muscle. We can then go back to its proximal belly and palpate it toward its proximal attachment on the lateral supracondylar ridge of the humerus. So the brachioradialis runs from the lateral supracondylar ridge of the humerus to the styloid process of the radius. The triceps brachii is located in the posterior arm. It attaches from the infraglenoid tubercle of the scapula and the posterior shaft of the humerus, and all three heads run distally to attach to the olecranon process of the ulna here. All three heads do extension of the forearm at the elbow joint. To engage this muscle, we have the client attempt to extend the forearm at the elbow joint against the resistance of our thigh, and we can palpate the muscle as it contracts. We palpate from proximally to distally, feeling for the engagement of the muscle as the client contracts against our resistance, and the muscle softening when the client relaxes. We can palpate the muscle all the way to its distal attachment at the olecranon process of the ulna. To palpate the proximal attachment of the triceps brachii on the scapula, we first locate the deltoid. We give resistance to horizontal extension of the arm at the shoulder joint and find the border of the posterior deltoid. We then relax the client and we reach in deep to the posterior deltoid, gentle but firm pressure, reaching in slowly, and if the client extends her forearm at the elbow joint against the resistance of her thigh, we can feel for the engagement of triceps brachii and follow it right to the infraglenoid tubercle attachment on the scapula. Palpate the pronator teres through the brachioradialis. The pronator teres attaches from the medial epicondyle of the humerus and the medial supracondylar ridge and the ulna, and then attaches to the lateral shaft of the radius. To engage the pronator teres, we need to ask the client to perform pronation of the forearm at the radio-ulnar joints against resistance. As the client pronates her forearm against our resistance, we can strum perpendicularly across the muscle. We begin palpating it proximally and then work our way distally. At a certain point, the pronator teres runs deep to the brachioradialis, which we can see right here. To palpate the pronator teres deep to the brachioradialis, we need to find the border between the two muscles. Once we have found the border between the pronator teres and the brachioradialis, we know how far we can palpate it superficially. To then palpate the pronator teres deep to the brachioradialis, we would need to push the brachioradialis out of the way. We can accomplish this by slackening it, by flexing the client's forearm at the elbow joint. We then push the brachioradialis out of the way and palpate the pronator teres directly on the radius as the client pronates. The supinator, as its name implies, supinates the forearm at the radioulnar joints. This muscle attaches proximally to the lateral epicondyle of the humerus here and the supinator crest of the ulna here. It then comes around to attach to the shaft of the radius here. To locate this muscle, we first need to locate the radial group of muscles, or the wad of 3. We search for the natural separation of tissue between this radial group and adjacent musculature. When we find it, we gently pull the radial group away from the forearm, and then we push down into the radius, which will be the distal attachment of the supinator. We then ask the client to supinate the forearm against our resistance. When the client contracts, we push down and feel for the engagement of the supinator against the radius. To palpate the supinator where it is deep to other musculature, we do flat palpation through the other muscles and feel for its contraction as the client alternately contracts against our resistance and relaxes it. We can then follow it all the way back to the proximal attachment. The flexor pollicis longus, as its name implies, attaches to the thumb. It crosses the wrist joint, and then in the anterior forearm it widens out, and it very often ends here. But sometimes there is another portion that runs up and attaches to the medial epicondyle of the humerus. To palpate this muscle, let's start where it's easiest to first find it in the distal forearm. We ask the client to flex the thumb at the interphalangeal joint only. As the client does this, we feel for the contraction of the muscle and follow it proximally in baby steps as the client alternately contracts and relaxes it. To palpate the flexor pollicis longus in the hand, let's begin again in the distal forearm. Ask the client to flex the thumb's interphalangeal joint and follow it in baby steps distally to its attachment on the anterior surface of the distal phalanx of the thumb. As always, we do this in baby steps as the client alternately contracts and relaxes the muscle. For a more powerful contraction of the flexor pollicis longus, we can add resistance to the flexion of the thumb. It is important when adding resistance to only add the resistance to the distal phalanx, or other muscles will engage, making it difficult to discern the flexor pollicis longus from these other muscles.